everybody. I'm DiLiberti. I am a professor of Humanities at the College of DuPage, and I am also the Global Education Liaison for faculty. I'm with Andrea Polites today. She's an assistant professor of human services at the College of DuPage, and she has also worked in public accounting. She was the CEO of a business. She was a clinical director at Family Shelter Services. So Andrea has a long history of working in mental health, and she has a long history of working with people from different cultures and different ethnicities. So Andrea, I think we're gonna talk about women. Women and COVID and addiction and COVID, and then your overall arching umbrella for this is mental health, correct?
Correct.
Correct. I want Andrea to stand up and show you her shirt before we go further, because she's wearing a great shirt today.
Says human services.
Her field. There's a shirt. So Andrea, if we just throw this topic at you again, what would you tell us about mental health and addiction and IPV, which is intimate partner violence?
Well, what I've always enjoyed is working with people, and I find people to be very interesting. And one thing that I don't know that I would ever get an argument is that people are naturally gregarious. They seek out each other. They truly aren't constructed to be alone. And so the difference now with this global pandemic and the way the world has galvanized around social distancing is there's a huge isolation factor that works in many different ways. People are home maybe alone, cut off from the rest of the world, or people are home trapped with people that might be physically or emotionally abusive. It could be children. There's recently been concerns about children who are home in an environment where social workers don't necessarily get to check on the families and follow up. So they were truly left alone, maybe in an abusive environment, as well as adults being abused by other adults, not being able to connect with therapists or priests, religious support groups, until recently when the agencies have allowed this telecounseling, which is, of course, on the rise because it's the way most people can connect with others. But it's not something you just flip on your computer and then talk to somebody at the other end of it. There's some training that's required and protocols and security.
And I know there are online Zoom AA meetings and those and helplines, but the problem is you have to have access and ability to use those things from home.
The technology, and there's also.
And if you're living with someone who perpetuates violence on you, do you have quote unquote permission to use the phone or the technology? Yeah, I'm sorry. Go ahead.
It's not that we've never dealt with large scale disasters. We've had oil spills, we've had hurricanes, tsunamis, traumatic events like 9/11. But the difference in the new novel piece of COVID is this: it's not ending. We don't know if it's ending, and how we're dealing with it. The world galvanized around stay away from each other, and that's a pro and a con. You certainly aren't going to be able to spread the disease if you're not with somebody, but at the same time, older adults, they're not going to be intellectually stimulated. They're not going to be able to function, and cognitively it will affect them. Cognitively, this is going to affect children who are, overnight had to start learning e-learning with their computers and not being socially interactive with other children. Think about recess and simple phys ed classes that a 9 or a 10-year-old can run around the gym for a half hour. That's a natural need to move around, and then you're compressing them down to their kitchen in front of their laptop, and it's different, and we expect them to adjust without reacting to it.
Right. Right, and I suppose we could say the same thing for adults too. That I also read an article where a woman said part of the reason we're in a brain fog is that our brains are not actually taking two things. We are in this constant fight or flight. So even when we're home, we're sort of worried about whether we have enough toilet paper or whether we have enough milk, and whether there'll be a food supply. But also, so there's this fight or flight even when we're supposed to be relaxing, but we're not taking anything new into our brains, and so this is frustrating us, and actually it's not making us calmer, it's making us more, I don't want to say anxious, but more restless. Maybe.
More anxious, more agitated, more anxious, more frustrated, and so needless to say, addiction, someone who's already addicted is going to find that they need to drink more or use more to numb themselves. And maybe people who didn't drink before find that that drink takes the edge off. Alcohol consumption is up, but at the same time, it's up because the bars and, I'm sorry, this is my granddog here who's with me.
Hello, dog.
As anxious,
A comfort animal.
Yes. So here is a situation where my son-in-law's grandmother passed away, and there's nowhere to board the dog because of the social, the restrictions
Distance,
and
yeah.
that, and at the same time, the funeral, and some of the things people aren't thinking about, people are dying alone. They have medical personnel with them there, and grief is part of life. And when you have to grieve alone, without that final contact with a loved one, that's difficult. So that causes even more anxiety. But
right. I know I think we're all sort of worried. Is my family going to come away unscathed? Will I come away unscathed? I mean, that's always at the back of our minds. I want to go back to this idea that you started out talking about, because we know that domestic violence is on the rise worldwide. In fact, it was so concerning that the Secretary General of the UN tweeted asking for peace in homes across the world. We know that in certain countries, I don't have my statistics here, but in Kenya, it's up 34%, and IPV, so intimate partner violence. The UN is predicting 15 million additional cases as a result of the pandemic. And then I was reading an article that said in Psychology Today, which was relying on UN statistics and laying out some common things that are happening. Social isolation comes up in both, it's one of the key factors in addictions, and it's one of the key factors in IPV, intimate partner violence. Social isolation, stress, which you talked about that cycle. Well, I'm going to ask you to re-talk about that cycle, because I think there's economic anxiety and joblessness, which some people say taps into that quote, those definitions of quote, what's manhood and what's womanhood, and that if men are identified with this job and then they're worried about joblessness, or there's economic distress, it does, or I guess I shouldn't say men, that's predominant. But that anybody who's going to perpetrate violence is often cued by this role being threatened by lack of, being able to provide, and then there's this lack of resources. But I think one of the key ones is social isolation. We were talking earlier, and you mentioned social isolation in terms of the grief, but it comes up as a factor in both IPV, and it comes up as a factor in addiction. Can you kind of elaborate on social isolation's really key role in provoking increasing incidence of both of those, of addiction?
Usually you've got a support system around you. You know, many people feel like, why don't you leave? Well, there's a lot of reasons people don't leave their abuser. And with children, unlike us, we can go out to dinner to a restaurant and not enjoy the meal and say, well, we'll come back to the restaurant and we'll give it another chance. But if after one or two times we don't feel that it's worth our money, we won't go back to that restaurant. But children aren't going to do that with their parents. The underlying myth about, that people don't understand is that children love their parents, whether they abuse them or not. So here they are stuck with their parents, and they're not able to go to school, which might be 8-10 hours away from that.
Right, a safe haven, right?
Or even to talk to somebody about it, whether they're in therapy for some reason and they can talk about their situation, whether it's an adult or a child, they're cut off. Until recently, when they started the telecounseling, they've been cut off with all that. On the other side, the person who's doing the abusing, and I always like to say, we're not bad parents, it's compromised parenting, because things happen to adults. I'm not justifying abuse of children, but you get fired from a job, you have a bad day, you come home and you kick the dog, you come home and you hurt your child. So this is all going to be more, parents are going to be more at risk for the fact that they're trapped at home with their children when they aren't used to watching them or working with e-learning with them. And so it's just ripe for things to be worse without intervention. Again, when you're trapped in the four walls of your house. But all of those circumstances, they fuel frustration and anxiety and the tempers of the controlling party, be it a parent over a child or an adult over another adult. And the lack of connection to other humans frustrates and cuts off and isolates the victim. So it's just it's a really bad equation.
Right. Because abuse in the first place depends already on social isolation. So now it's on steroids, right? You isolate, and then that person becomes your sole support network, and so then you can't get out. I know that in other countries they've decided to come up with some strategies. There's a website called togetherforgirls.org that has a bunch of tips and resources. But in Bolivia, they've started training hotel staff to look for red flags for women and children. But apparently, child trafficking is up as well now too. Yeah. And so they've trained hotel staff to look for red flags and to sort of maybe be able to ascertain whether this child should be traveling with this adult. And in Buenos Aires, for example, they've trained store managers. So there's 630 supermarkets where, because women go to the supermarket, right? And so that's a common thing. They probably won't need too much permission to do that. Maybe, I don't know. But so they've trained managers of supermarkets to be a place where women can express their distress or seek help. In
the United States, Julia, beauticians are hair dressers. They take special training on domestic abuse, and that's
right. But nobody can see them now. So I mean, I think the thing about the supermarket is
that's another way that we could have intervened. And now with the plastic shields up, there's very little contact with the store, any clerks you come into. So these other countries actually have been far more creative than we have.
Right. And we do know that it's interesting because The Economist says that most types of crime are down except domestic violence. And then by the same token, I don't mean to, just yesterday on NPR, they were talking about how the drug trade has been ridiculously disrupted by this. And so that people are looking for fentanyl, and that they now have women in the poppy fields, but that puts these women at risk because it's, anyway, so that the drug trade being disrupted means people are going to be paying higher money for poorer drugs or more dangerous drugs. So this idea of social isolation too, I can't speak, I've spent too much time alone. This idea of social isolation in terms of drugs, they're concerned because people used to sort of do drugs together, right? If you're addicted, but now if people are doing drugs alone, there's nobody to stop the overdose. There's nobody to call 911 if something goes too far. So I guess I'm going to turn it back to you because this is the kind of stuff you deal with daily in your practice and in your classes.
Well, all of this, and I want to go back to something you said earlier about adequate resources. I think something that COVID did, on May 14th, the United Nations issued a number of reports and briefings and whatnot. But one of the things that they said is COVID exposed the fact that the world was way under-resourced for decades regarding dealing with the needs of people from a mental health perspective. And they said, the UN guidelines said that depression and anxiety before we had COVID, it cost the global economy $1 trillion a year. Okay, that's before COVID. And that 264 million people in the world are affected by depression. And what doesn't get thought of is that this stuff starts at 14 years old. Mental health, that stigmatized word, I think at some point in our life, we've all had some type of event that's depressed us or traumatized us, whether it's a little trauma or a big trauma. But the idea that there aren't enough resources. In Sudan, if you lived in southern Sudan, there's only one mental health professional for every 4 million people.
Wow. So
think about that, and then how do you get there? Okay, we have the resources now of telecounseling and other things. But you'd have to, the way they explained it, you have to travel 2,000 miles, and it would take you 30 hours to get to your mental health person. So, right. And it's not like the phones or the technologies like it is here. So that's I think, I don't know that we're ever going to see the full ramification of being cut off like that from the world, that we're being isolated, and then coupled by the fact that we're already isolated because we live in this country like Sudan, or even in the rural parts of the United States. You have social isolation on top of an environment you're already somewhat isolated in.
So well, I mean, I think kind of what tell me if I'm wrong. What you're saying is these problems existed before COVID has just exposed them, and maybe the actual numbers, or the numbers that have been hidden, and that long term we have no way of predicting
the fallout from it.
the fallout.
Yeah, it is just like we have. Andrew Love is in charge of the older adult part of the county, that he does investigations regarding elder abuse. And he said the primary cause of abuse is that they're isolated. Right. They're alone at home with a child that's taking their Social Security check or not feeding them. So now these social workers and people that would check up on them, we've got, that's got to be reformed, the way we actually check on. So the social isolation fuels a lot of faux pas.
So for you, I mean, this is really just putting the microscope on, the magnifying lens, on stuff that already existed. I mean, you're saying this is enhancing our vision of what already ailed us as societies.
Without a doubt. I mean, people already drank too much and for the wrong reasons, but now they're doing it even more because they can't get support. The World Health Organization says that there's 60% of the people in Iran, something like 40% of the people in China, 50% of the people in the United States have higher, that's the increase in anxiety. So you have a 50% increase because, and
I guess I'm surprised it's only 50, but yeah.
Well, we are so inundated with information. I mean, I'm sure I can find another article that says something else. But again, it all comes back to this idea that there are people who are upset that we have people like governors telling us what to do. I mean, I think you saw what happened in Michigan when they, stormed the Capitol. And so that's another piece that enters into it, that I went out there, let's say, and I got my car and I parked it to be part of the traffic jam, but I still have to go home and follow the governor's rules. So I'm mad and I'm going to take it out on my child. I'm mad and I'm going to take it out on my partner. So, right. So some of the solutions are fueling the problems.
Yes. Okay. That's wow. I got to take that one in a little bit. I mean, I think, yes. I mean, social isolation is a solution that's fueling two problems, addiction or causing them to be both more dangerous. So tell me what I haven't asked you that I should, and then let me wind down by asking you also, after you, if there's anything you wanted to say that we didn't get to, but let me wind down by asking you, how would you, if you have suggestions for how people can cope, or if you have suggestions for how people can take on COVID and be less stressed, and maybe that's not, I don't know if you have thoughts on that or not.
Well, I think it's really important to get out of your house. I mean, what I have, I don't see clients. I had a private practice. I don't see clients, but occasionally they'll call me now and we'll talk on the phone. Just going out for a walk seemed to help a lot of people. It's helped me get out on a nice day, doing yard work. I know that some of the states don't have golf courses open or some of the parks. But I think if we can find a balance between doing things that ground us. For some people, churches were important. I know people who would just love to be able to go sit in a church. And I think what's helped is the social distancing in some of the churches where they've opened up and they've taped off every so many pews and that. But I think you have to recognize the fact that you are isolated. So doing everything you can to de-isolate, even if it's alone outside, you see other people, don't approach them. But you got to get out of your house. And I think it's important to acknowledge that you're frustrated by it. I mean, we're not made of steel. I think you have to sit down and go, I don't like this. And if it means journaling about it, or, I'll have a story to tell my grandchildren or my children.
I can tell my students when we first started this, I said, listen, take your fear out for a cup of coffee and acknowledge it and thank it for keeping you alert. Spend 10 minutes a day with your fear. And then after that, reel it back in. Say, thanks, fear. I'll call you when I need you.
You have to take a break from all the information. It's information overload. I mean, those numbers up there, I stopped watching CNN because I'm going, those are numbers, but those are people that are gone from this world. And
Right.
we've objectified so much by making it a statistic and quantifying, are we on the peak? Are we on the way down? We're just having some difficult times now. I know somebody posted something about, wow, whoever said, where are you going to be 10 years from now? And they were all
Everybody
wrong.
got it wrong, right?
Yeah, but the idea that you just have to accept it. I mean, whatever it takes for you to just sit with it, instead of trying to fight it, because we can't fight it. I mean, I don't think we even understand it all yet.
Right. No, new stuff keeps emerging every day. So
Being kind to each other, because another thing that's come out is from the whole cultural perspective, the discrimination and the flare-ups, like after 9/11 with the Arabs and the Muslims. We've got people attacking Asian Americans like it's their fault this happened. And we need to remove that stigma of, did it come from China? Did it come from somewhere else? Whatever, it's here, and we need to be kind to each other.
it didn't actually. It came from a bat. We know it came from a bat. So,
But again, people, that misinformation going out then, and some poor person walking down the street, this is your fault, which is part of the frustration that I don't have control over it. So if I hit you, I can blame you, and now I've got control over the situation.
I see. So it's about so find ways to sort of take control back without harming others. Let your way to control be, how do I be kind to others?
Yeah. And do things that stimulate your brain. Do a puzzle, do a word search, organize a closet, anything that gets your brain going, because you can stagnate. You can sit in front of TV and stagnate. So.
Okay. Any other parting thoughts, Andrea? Thank you.
No, I appreciate you doing this. And I think looking at the different perspectives of how COVID affects us is something that I appreciate you doing.